Here's our benefits manager, and then last night I sent one late explaining how we were going to postpone our safety meeting today and instead just dedicate the whole time to this insurance benefits presentation because it's worthwhile. There's a lot of information, there's a lot of options to consider, and I wanted you to have this time to, not only me, but our management wanted you to have this time to ask the questions to the broker. So with that, just a few ground rules as usual. If those of you who are attending today's meeting via cell phone or phone call, if you could please mute your phone so we don't have the background interference, that would be appreciated. We will have questions and answers throughout the presentation, noting that the field services and others who are in the field will only have a small time that they can participate. So if there's questions on particular slides, Lisa, who is our broker's agent with Dooley, Bulwar, and Peterson, will be presenting, and she's open to answering those questions as we navigate through the presentation. So please feel free to announce your name as usual so that those of us behind the screen understand and acknowledge who's speaking, and that way we can address information back to you as necessary. And again, if you could mute your phone calls, if you could enlarge your screens for those of you sharing so that you can review this presentation in its entirety. And at this point, I am going to turn over the meeting to Carmen, who is hosting Lisa, our insurance broker, again with Dooley, Bulwar, and Peterson. Ladies, I'm turning the meeting over to you now. Thank you very much.
Thank you, Ramona. Carmen, do you want me to just go ahead and start? Okay, good morning, everybody. My name is Lisa Palomares. I'm with your benefits broker. As Ramona mentioned, Dooley, Bulwar, Peterson. This is your open enrollment meeting. This is your open enrollment time. Now's the time if you have questions, that pertain to the group, definitely feel free to ask. If it's something personal, I definitely can give you my contact information and you can see me after or give me a call after. Sorry. So starting off with our presentation, it's our benefits enrollment. I did notice I put 2019, but it's actually for 2018. It's December 1st. 2018 is when the benefits are starting. I think 2019, of course, is always on everybody's mind. We're so close to it. But your benefits that I'm going to speak about actually take effect December 1st, 2018. So enrollment is mandatory, which means you need to go into Employee Navigator, which is an online system, which I'll talk about in a couple of slides. It must be completed by all employees. So even if you're waiving every benefit, you still need to go online and make your elections or waive the benefits. It's your responsibility to make sure it's completed. We'll get kind of reports along the way just to make sure everybody's completed it, but please complete your enrollment. The enrollment, I know some people have already gone into the system to start enrolling, so it starts today if you haven't already started, and it's going to end November 21st, so right before Thanksgiving. So you have a short amount of time to complete your enrollment. The website that you're going to enroll in is open 24/7, so you can enroll any time of day, on the weekend. You can enroll for your benefits. It is a short period of time because, like I mentioned, your benefits start December 1st. Your benefits, when you elect them, will be locked in until December 1st of 2019, unless you have a qualifying event, which a couple of examples are if you get married, if you get divorced, if you have a baby, if your spouse has coverage and loses it, if you're covered elsewhere and lose that coverage, any status change, those are qualifying events where you can come onto the plan or drop the plan throughout the year. Otherwise, December 1st is your time to elect and time to make changes next year. So what's new effective December 1st, 2018? We will have a new medical carrier. So Primera is your carrier through the end of this month. December 1st, Cigna will be your new carrier. We actually have 3 great plans for you to choose from, giving you a choice of a plan that you would like. Cigna has a national network of providers. I know we have a lot of people out of state. They have a national network. So the biggest network actually that they have is called the OAP, which you would be part of. If you do elect medical coverage, Western Electrical pays for a flat $15,000 of life insurance along with that medical plan. Our new dental carrier will be Lincoln Financial. Vision will be with Guardian. Our life and disability will be Mutual of Omaha. And like I mentioned, employment or enrollment will be completed through Employee Navigator, which is our online system. So I'm going to talk about each of the three plans. Everybody should have gotten an enrollment or employee benefit guide. They also contain all of the plans, all of the rates, but it's nice to kind of review the plans so you can make decisions. The first plan is our base plan with Cigna. So still using the largest network of providers, the Open Access Plus, but you'll notice this plan is in-network only. So you do not have any out-of-network providers that you can see. I always encourage you to stay in-network. Your in-network providers have contracted rates or fees with Cigna. So staying in-network is something you should always do, but this plan is only in-network benefits. Your deductible on this plan is $6,250, but your deductible does not apply to all services. If you notice on this plan, if you see a primary care physician, you have a $40 copay. If you see a specialist, it's an $80 copay. Your deductible is coming into play if you have to go inpatient, outpatient hospital, if you have an MRI, if you have a CAT scan. At that point, you're paying towards that deductible of $6,250. After the deductible is met, it goes into coinsurance. On this plan, it's 70%, which means Cigna pays 70%. You would pay 30%, up to the out-of-pocket max of $7,350. Now, I know it sounds like large dollars, large numbers, but this is in a bad year. If you have a surgery, if you're in the hospital, if someone has a baby, there's a ceiling that you would pay out of pocket before Cigna would pay 100%. On this plan, it's $7,350. Now, like I mentioned, not everything is applied towards the deductible. Your lab, your x-rays, that's paid at 100%. Your deductible is waived. That's your labs in the doctor's office, your x-rays in the doctor's office. It says except complex imaging. That means except MRIs, CAT scans. That's your more complex imaging. Urgent care, it's a $75 copay. Your emergency room is a $400 copay. Now, your out-of-pocket max is also considered your bucket. So everything that you paid for the year, all of your copays, if you have an MRI, it goes towards your out-of-pocket maximum. That's your bucket. Your deductible goes towards that out-of-pocket maximum. So once the out-of-pocket maximum is met in a difficult year, the plan will pay 100% after that. Your pharmacy, so any prescriptions, you have 4 tiers, $20 copay for a generic. You have a $45 copay for your next brand name, $65 for any formulary brands, and then $150 for any specialty. Even your prescriptions, as you're paying those copays, goes towards your out-of-pocket max. Now, when we look at the rates or what you're paying from your paycheck for this plan, this is going to be the cheapest plan that you can elect as far as anything coming out of your paycheck. Now, your employer contributes an extremely generous amount towards your benefits. I have a lot of customers. There's not a lot of employers that pay as much as your employer pays towards your benefits. But if you're looking at what's coming out of my paycheck, this plan is going to be your most economical. But remember, you're going in-network only. That means you have to choose contracted providers with Cigna. Now, you don't have to name a provider and say, okay, this is my provider. Just make sure you're looking in the network of providers for Cigna. Contracted with Cigna. Any questions on this plan? So your second plan is what we call our middle plan with Cigna. You notice on this plan you have in and out of network benefits, but I still encourage you stay in your in-network providers. Your deductible on this plan is $5,000. So also on this plan, you'll notice your primary care visit is a $45 copay. Specialist is $45. Your deductible isn't applying to all your services. It's applying if you have to go inpatient, outpatient, complex imaging, those types of services. On this plan, once $5,000 deductible is met, Cigna will pay 80% After that, you would pay 20% up to the out-of-pocket max of $6,350. So this plan, the out-of-pocket max is less. Your co-pays for primary care is just a little bit higher. Your specialist a little bit lower. Your urgent care is $75. Your emergency room is $300. So if you're comparing between the last one, you know, the co-pays under this plan for your ER is a little bit less. Your co-insurance, once you meet your deductible, is 80% instead of 70%. Your prescriptions are the same, $20 for generic, $45 for your next tier, $65, and then $150 for your specialty. Now, all of the plans that I'm talking about with Cigna, your annual physical, your annual exam is paid at 100%, no deductible, no copay is applying, which means your well women visits, your well men visits, mammograms, immunizations for your kids, paid at 100%, no deductible, no copay. Now, you know when you go in for your annual physical, sometimes you have a list of, okay, I'm here for my physical, but my neck hurts, my shoulder hurts, my leg hurts. Once you start saying, okay, I have all these issues, they're going to charge you a copay because now it's no longer your annual physical. Now there's something wrong. They have to diagnose you. But if you keep it at your annual physical, it's paid at 100%, no copay, no deductible. So I encourage you, go for your annual physicals every year. Your annual physicals are going to determine if there's something going on. It's paid at 100%. I know it's hard to take time from your day, but I just encourage you, please get your annual physicals every year. The last plan I'm going to talk about with Cigna is a buy-up plan. So this is the richest plan. It's going to be the most coming out of your paycheck also, though. If you look at your deductible on this plan, it's $1,500. Your copay or your coinsurance after the deductible is met is 90%. So on this plan also, deductible is only applying towards your hospitalization, MRIs, CAT scans. Once the deductible is met, Cigna will pay 90%. After that, you would pay 10%. Up to the out-of-pocket max of $4,000 for single, $8,000 for family. Your copays under this plan, $30 for any of your primary care specialists, walk-in clinics. Does everybody know what a walk-in clinic is? Those are the clinics at Walgreens, CVS. It'll say Minute Clinic on the outside. They have them all over. That's convenient. You know, if you maybe have a sinus infection, if you have a cold, if you have the flu, and you don't necessarily, you know, have time to make a doctor's appointment, those walk-in clinics are convenient. You go in, you pay a copay like you're going to the doctor. And a lot of those clinics now, you can even make an appointment online. So those are very convenient. I use them a lot. You know, I go for my annual physical, paid at 100%. If I get sick during the year, I'm taking advantage of those walk-in clinics because that's quick, it's easy, you can get in, you can walk across the aisle, they'll give you your whatever you need, and you can. On this plan, your emergency room is urgent care is $75 copay, emergency room is a $300 copay. Everybody knows when you need to go to the urgent care, right? If you've broken a bone, you probably shouldn't go to the urgent care because they're probably not going to have what you need. But, you know, if you're just feeling poorly on the weekends, if it's after hours, if you feel the need to go to the urgent care, just look at your copays, $75. Your emergency room, if you're having chest pains, if you can't breathe, if you have a baby with a high fever, don't go to that walk-in clinic, go to the ER. You know when you need to go to the ER. Just don't go to your ER and have a stuffy nose because you're $300 copay. Your prescriptions under this plan are the same, $20, $45 for the next tier, $65, and then $150 for your specialty. So you have 3 really awesome plans you can choose from with Cigna. Like I said, Cigna's biggest carrier, biggest network, so the likelihood of any physician that you're currently seeing being in the network is extremely high. Any questions on the buy-up plan? Okay, so looking at our medical rates, and these are also going to be in your employee benefit guide. Like I mentioned, that base plan, the in-network only, is going to be the least amount coming out of your paycheck. If you go for that middle plan, you'll see the weekly cost there, and then the highest plan, the buy-up, the $1,500, you'll see the per paycheck cost. Like I mentioned, Western Electrical pays a huge amount of premium for your insurance, very generous. So those per paycheck costs are extremely low from what I've seen. Just some medical tips. I always like to mention at my meetings, register for the MyCigna app once you get your ID card. That app can help you manage claims. You can search for providers. If you have a surgery coming up and you maybe have a knee surgery, you can look at the cost for that surgery, what's going to come out of your pocket, cost for medications. MyCigna app, they have a mobile app. Everybody has their phones, right? Some people, their phone's right next to them when they go to sleep at night. Register for the mobile app. It's a great app, but register online also. Cigna also has telehealth. Telehealth is even more convenient than your convenience clinics. Telehealth, you can call a doctor. They'll call you back and, within an hour, within 20 minutes, you can talk to them over the phone. They can do a virtual visit. It's great for those illnesses like, okay, I have a sinus infection. I have an earache. I have a cold. I have the flu. My kid has a cold. My kid has a flu. Those types of illnesses, they can diagnose. They can prescribe your antibiotics. They can call it in, and you never leave, where you're at. Maybe you're at home. Maybe you're home sick. You don't want to go around a bunch of other sick people. Telehealth is great, and what you pay is you pay your copay as if you're going to the doctor. So there's information on telehealth that I provided. I actually brought some, and I can scan it to your other locations on the telehealth. Convenience care clinics, like I mentioned, CVS and Walgreens, it's just like you're going in for an office visit copay. And then check mycigna.com for a full list of services covered under preventive care, like I mentioned. So any questions on the medical? Oh. Okay, so moving on to the dental. Your dental is going to be effective with Lincoln Financial, effective December 1st. Similar plan design is what you already have with your current carrier. Your dental will start December 1st. So because we're switching carriers to Lincoln, you get a whole new maximum December 1st. So $2,500 that you can use. If you have some dental work that you're trying to get finished for this year, $2,500 right away from Lincoln. That maximum starts over January 1st. You get a new maximum January 1st. You can double dip. Double dip a little on your dental. Take advantage of that. Your routine services, so cleanings, x-rays, exams, they're paid at 100%. No deductible applies to that. Any basic services like root canals, gum disease, extractions, there's a $50 deductible that applies. Then the plan will pay 80%, you would pay 20%. Any of your major services like crowns, bridges, dentures, Lincoln would pay 50%, you would pay 50%. But like I mentioned, $2,500 maximum, that's really rich when it comes to a dental plan. A lot of the plans I see, it's $1,000, it's $1,500. $2,500 is a great, nice maximum for you to utilize. Just remember, go in for your preventative. I know sometimes the dentist is more expensive than the medical carrier, but make sure you're getting everything taken care of with your dental work. You have a really rich plan. I encourage you, even with Lincoln Financial, go to your contracted doctor or dentist. Don't go out of network, stay in network, because you're going to get all of your discounts if you stay in network with the providers. So a couple of, here's your dental rates. So again, your employer is very generous in what they pay for your per paycheck cost. Your weekly cost is at the far right. If you're biweekly, it's in the column right next to that. So very generous dental plan. Just remember, you take advantage of everything, being able to double dip. You can search for a dental provider. We've also included in your benefit guide how to find a provider with Lincoln Financial. Anytime you're getting any services over $200, sometimes you go to the dentist and you think you're going for a cleaning, and before you know it, there's a list of services they want you to have. Anything over $200, tell the dentist you want a pre-treatment estimate with Lincoln Financial. That way you know before that dental treatment starts, what is Lincoln going to pay, what am I going to pay before you even start that treatment. Just like Cigna, your in-network providers have agreed to a negotiated fee with Lincoln Financial, which is going to be less than if you try to use an out-of-network provider. Like I mentioned at the beginning, you have a new maximum of $2,500 that starts December 1st, and then it resets January 1st. Any questions on the dental? And you will receive a dental ID card with Lincoln. It's Cigna ID card, Lincoln Financial ID card for your dental.
Hi, this is Chris Foley. I have a question on the dental.
Yes.
It said 2,500 maximum. If you are employee and spouse, is that 2,500 each or for both?
Each family member has a $2,500 maximum.
Okay, thank you.
You're welcome.
Quick question on the dental as well.
Yes.
I've been looking, does it cover orthodontics?
It does not.
Okay, thank you.
Any other questions? Okay, moving on to the vision. Vision will be effective with Guardian. This is effective December 1st also. So even with your vision, I know you had vision in the past, they're not going to look at your past. So even if you had an eye exam last month, you got new frames last month, you can start over December 1st with Guardian. You can get a new eye exam, you can get frames, you can get glasses, whatever you need, because it's a reset, December 1st. You can receive an eye exam once every 12 months. There's a $10 copay that would apply. For any lenses or contact lenses, it's also once every 12 months at a $25 copay. And your contact lens or your frames is once every 2 years. And your frames, there's a $130 allowance, which means the plan will pay up to $130. If you need the Gucci frames and they're $200, you're going to pay anything above the $130. Your contact lenses, if they're medically necessary, so if you have an eye condition that requires special contact lenses, those are covered in full. If you have cosmetic contact lenses, like myself, I don't need contacts. I could wear glasses. I choose to wear contacts. That's a $130 allowance. So with Guardian, you actually, like I said, have a reset, so you can buy all new December 1st. Your vision rates, very, very cheap. So definitely take advantage of the vision with Guardian. It's really not a lot coming out of your paychecks. Just some vision tips. Find providers on GuardianAnytime.com. Some of the retail chains, Costco's very, very competitive. Sam's Club, VisionWorks, Walmart's very competitive when it comes to frames, and Nationwide Vision. And like I mentioned, you can double dip this year and get eye exams and frames without any waiting periods.
One question.
Yes.
If you're a Costco or Sam's, if you go in there, you don't necessarily have to be a member to use their services like this.
Correct. So Carmen mentioned for the group, if you're not a member of Costco or Sam's, you can still go in, get your eye exams, get your frames, and actually prescriptions also. You don't have to be a member with Costco and Sam's Club to take advantage of their prescription.
What type of Guardian plan is this?
Vision?
Meaning, no, I know that, but I called my current eye doctor and I asked them, did they take Guardian? She said, is it Guardian/VSP or is it a different type of Guardian?
ESP is a carrier themselves, so.
I'll check. I can check for you. Okay. Sometimes your carriers contract with vision carriers, so they kind of contract together. So I'll make sure and find out.
How about needing, say, glasses, but safety glasses with prescription? How does that go?
I'll check on the safety glasses. There's not a lot of the vision carriers that cover the safety glasses. There may be some type of discount you could get on the safety glasses, so I'll check. Yes?
Oh, no, it was just.
He's asking for you?
Yeah.
I'll check on both of those.
Question on vision again. so it starts December 1st. Does it reset then January 1st again also?
It does not. So your vision runs a little bit different. Your vision runs off date of service. So if you get new glasses and you go for your eye exam December 4th, then you're not going to be able to go for a new eye exam until December 4th of the following year, because it's once a year, but it does not reset January 1st. But if you've got, I know you have vision now, if you got glasses or you went for your eye exam, when you go December 1st or after, they're not going to look back and say, oh, they just had an eye exam. It's going to start December 1st, but it's going to take, if you go, like I mentioned, December 4th, you can't go until December 4th of the next year.
It almost sounds like we can kind of triple dip in some areas then, because if you can get in and get some of these things like dental on our old carrier,
yes,
get our 2,500, get 25 in December, and then 25 new in January.
You have to move quickly, because you have to get on your old carrier through November 30th. Right. Your new starts December 1st, and then your dental resets January 1st.
If you can pull it off, guys.
That's a whole lot of grill work.
That's a whole lot of work.
It's expensive, Tony. It's expensive.
It is expensive, but definitely take advantage of it. Now, I did want to mention the medical. I want to just backtrack a little. Your medical deductibles, so if you're already tracking towards your medical deductible, that always resets January 1st for any carrier. So if you're tracking when Cigna takes over, I'm thinking we could probably get any deductible credit, but then you're only going to have through December, because January 1st your deductibles start over for your medical. If anybody's tracking towards your deductible or you're concerned about that, definitely give me a call and I'll give you my information at the end. So talking about life and disability, this is very important insurance, just like your other coverages. Western Electrical pays for 2 times your annual salary up to $100,000, which is just, a lot of carriers or groups I have, it's just flat amount, that's it. But this is a very generous life insurance benefit. Please remember, I know Employee Navigator, I guess, isn't capturing your beneficiaries, but we'll get that fixed. Always update your beneficiaries. Anytime your life changes, make sure you're updating your life insurance beneficiaries, because if a claim occurs, we're going to pull that most recent beneficiary. That's who gets the money. So just make sure you keep your beneficiaries updated for your life insurance. The short-term disability is for off-the-job, accident, injury, sickness, pregnancy. The benefit is 60% of your weekly pay, up to $750 a week. It starts on the first day of an accident, the 8th day of an illness or a pregnancy, and it covers you for 26 weeks. Even the short-term disability, a lot of plans I see are voluntary. A lot of the plans I see don't start till the 15th day. So this is a really rich short-term disability. But remember, it's off the job, type of accidents, illnesses. On the job, you have workers' comp. This is for anything that happens off the job. If your disability continues past 26 weeks, you can go into long-term disability. Long-term disability is going to cover 60% of your monthly pay, up to $3,000 a month. And it starts on the 91st day. If you're on short-term, it'll flow directly into long-term disability. Long-term disability will cover you till Social Security normal retirement age, which now it's about 67, 68 years old, because we're working longer. But awesome benefits that you have that are not voluntary. These are your benefits that your employer is paying a portion of. So great benefits.
And this is mandatory, guys. Everybody must carry short-term, long-term. You cannot waive that insurance.
And I always like to mention the Employee Assistance Program. This is through Mutual of Omaha. This is for you as employees. It's free. It's unlimited telephonic access to counselors for all of those issues we all have. Job stress, family stress, financial issues. It's purely confidential. Your employer doesn't get a report that shows who talked to who about what. You have an 800 number that you can call. We also have information in your employee benefits guide, 24/7. It's also free of charge for any dependents in your household. If they have issues that they need to talk about. It's a great benefit that I don't think is as utilized as it could be by employees, but definitely know it's there for all of you. And then finally, there's a travel assistance program through Mutual of Omaha. It assists you if you're 100 miles from home and you lose your luggage, if something happens to your ID. There's an 800 number. In the benefits guide, there's also some information with a little tear-off sheet if you want to carry it with you. That's free of charge also. Any questions on the life and the disability? So we are going to be enrolling through Employee Navigator. The information or how to enroll is actually in your benefits guide on page 4. If you have any issues or can't get through the system, or if you need help with any of the enrollment, because we have a short period of time, because the reason why we have a short period of time, we want everybody to be able to get in the system with all of the carriers so you can take advantage of your benefits effective December 1st. We have a company identifier. Last four, your PIN is your last four of your social, and then your date of birth. Call this number, 800-251-9622. That comes to my office. You can ask for myself. I have an associate that built the system for you, so she can help you with any questions if you need assistance through the enrollment. Any questions at all? I know we rolled through that pretty quick, but hopefully the employee benefit guide is a lot of the information you're going to need. All of your carrier information is on the back cover. My information is on the back cover. If you have questions while you're trying to enroll about any of the plans, don't hesitate to contact us.
Hi, this is Anthony Diaz. I do have a question. So just to be clear, the dental and the medical are the ones that have the window for the triple dip, and then the eye is just resets when we enroll.
The dental, you can double dip for sure, because that starts December 1st and then it resets January 1st. Your medical deductible, once you start December 1st, if you've already been tracking towards your medical deductible, we can get that credited when we move to Cigna. So you're not starting over with your deductible when we move to Cigna, but your deductible for your medical resets January 1st. You have to start a new deductible January 1st with medical. And then vision, it goes by date of service. So if you go get glasses December 4th, then you have to wait, or go get an eye exam December 4th, you have to wait a year to get another eye exam, 2 years from that date to get new frames.
Right, I got it. Okay, thank you.
You're welcome. Any other questions?
Lisa, will you let them know when you check?
Yeah, can you go back to the medical out-of-pocket costs?
Yes.
Yeah.
Yes. Any particular plan you were looking at?
I think he was talking about the
just looking at numbers.
Oh,
that one, yeah.
okay. Yes.
There you go. That's the one.
Okay. And then it's also in your benefit guide. There's a page on it for your rates and your benefit guides too. Did everybody get a benefit guide out of state?
This is Anthony Diaz. I have not, but I think I can pick one up from the Phoenix office.
Anthony, you should have one in your email as a PDF as well. All
Okay.
WES received an email.
So you have a PDF version in your emails.
Okay, thank you.
PDF version doesn't have every one of these.
PDF version has all the rates. Yeah.
That slide right there is not in the PDF version.
Okay.
Yeah, it is.
Is it? What am I looking at?
Page 21.
Is this a different one or is it down further?
It's kind of towards the end. And Carmen, you wanted me to mention something?
Yeah, guys, when you're putting your registering on the Employee Navigator, when you're putting your company identifier, it needs to be put exactly like it shows you. There's no spaces in between Western Electrical Services.
It's in the last, almost to the last page that you were on.
To this?
Yeah, just the login.
And something else, our middle plan in the medical will mirror what we had before. So if you're looking at just something that was comparable to what we had, that middle plan mirrors the rates as our old Primera plan.
Did you find the rates in the PDF?
It is, it's,
Okay.
it's at the end.
Okay. Any other questions? If there's anything you can think of, especially if you're trying to decide, you know, at the point you're enrolling, any questions at all, definitely give me a call, send me an email. However, you know, I can assist you. That's why I'm here.
One thing I did think about, that middle plan, being since mirroring the old plan, there will still be the deductible coverage that WES kicks in on that plan. If you take that higher deductible, WES will still be contributing the $2,000 in the end once you've met that $5,000. So you would want to keep track of your deductible expenses. It will not, WES will not be contributing towards the deductible for the buy-up plan because we will be contributing more into the cost of the plan.
One last question here, Mamadou. Can you have access to your old plan and look at it and just compare and contrast so you can maintain it?
I could send that PDF out to you, Mamadou.
Okay.
But that middle plan will very much mirror it as far as deductible, your cost of your emergency room visits, co-pays. It's exactly the same pretty much across the board.
Okay. And once you get online to register, is that going to do the dental, vision, and medical all at the same time, or just one, or is that just for medical?
It'll take you through everything. So it'll start you with your medical. It'll make you add dependents. If you have dependents, you'll add them right in the beginning. It'll, you know, have you check your address, make sure everything is correct. Then it'll start you with medical. Then I'll take you to dental, vision, and then the life and disability after that. And it will ask you to confirm. So make sure at the end you confirm your benefits. So that kind of confirm, it'll say congratulations. It'll give you, you know, you can print out a summary if you want to. So it definitely asks you to finalize it at the end.
I noticed everyone needs to plug in their addresses. Make sure you plug in your street address. They're not in there. I'm assuming that's to make sure everybody's is current.
Yes.
So that we get ID cards mailed to our homes.
Yes.
So make sure you plug in your street address.
What age do adult children roll off?
Dependents are covered for medical, dental, vision to age 26. So once your dependent children turn age 26, they're off. Yeah.
Dual insured dependents, what determines primary and secondary?
Usually they're looking at the parents, your birth.
Your birth of,
Yeah.
of the actual primary on the insurance.
Yeah. So if maybe you're covering a dependent and your spouse is covering a dependent, the carriers usually look at, okay, whose birthday's first?
Yeah.
That's going to be primary. Secondary would be the
spouse.
Yeah. All really good questions. Any more questions?
Yeah, this is Darren. I've missed quite a few of this, but I'm back on the road. But I'm curious on our life insurance. Does that transfer over from our old policy to our new policy?
I didn't ask you the question.
I don't know what you said. Someone's logged in as you have second.
I didn't do that.
Okay. All right, Darren, go and give it a try again.
Yeah, can you guys hear me?
Yes.
Perfect.
Okay, I was curious on our old life insurance policy. Does that transfer over to the new one?
It's a similar plan, yes, but you still want to make sure your beneficiaries are updated.
Yeah, I don't know what it means by transfer. I mean, you have life insurance.
Right.
It's the same benefit.
Right. Your life insurance was previously is the similar plan to what you have with the new carrier. So there's no gap. There's no gap in coverage if that's what your question is. It goes from one to the other. You're just switching carriers, basically.
Okay, that's what I wanted to know.
Any other questions?
Yeah, I had one question. Am I able to add my wife to just the vision plan, or does she have to be on other plans as well?
No, you can. You don't have to have your dependents on all of the plans. You can pick and choose. You also are not tied to all the plans. You don't. You can choose medical and not dental or vision. It's not packaged together. You can pick as you want, and also for your dependents.
Okay, thanks.
Except short-term rentals.
Correct. Except your short and your long-term is mandatory, but your medical, dental, vision, you can pick and choose. Any other questions?
One question on the navigator. If I was on there yesterday and it shows a dependent and the dependent has been duplicated, how do you remove them? Because one way is that it's written out her last name to first name, and then the other way is first name to last name, and it shows her twice. I just didn't know I don't need her on there twice.
Okay. Maybe after the meeting, give me what's correct, and then I'll take her off.
Perfect.
Lisa, will you want to tell them if they have any problems logging in? It could be associated to them, or should we?
So Carmen had mentioned that you had Employee Navigator in the past through another broker, and what has happened is they're recognizing you. So we're trying to get that reset. And how did you fix it? Did you fix it at all, or you had to enter a personal email instead of the company?
Yeah.
So your previous Employee Navigator experience was linking it to your work email address. So maybe use your personal email address. I'll try to get that fixed today so that Employee Navigator can kind of wipe out the history from the past. Any other questions? Well, everybody has my information on this last slide. I'm also on the back page of the benefit guide. Please, please call me if you have any questions. You don't need to bombard Carmen. I'm your resource. I can help you. Just make sure, give me a call if you have a question. And everybody, don't wait till the last day to enroll. We got, 24/7 you can enroll on this website. So we'll track and see who's not enrolling.
Do you have a standard Q&A question and answer sheet? Is there some standard questions that people ask?
Not really. It's kind of different for each group. Mostly deductibles, things like that.
Because of carriers in the past, I noticed that as time goes on and you're not as involved, there's an awful lot of questions that we can answer internally very quickly and help our employees. So
I could definitely put that together.
If you have any kind of Q&A that we can have, then
sure,
we can head that off.
Yep. And I never move on.
You never move on? Okay. Yeah. Well, then in that case, we'll just go.
Yes. Any other questions?
Hey, this is Matt Wallace. Just as a reminder, this webinar was recorded, and so this morning we'll get this out to everybody, distribution list. So if you guys do have any questions, feel free to review the video. And if you don't get it, just let us know, and we'll resend it out to you guys.
You guys are pros.
Yeah.
Thank you.
Perfect. Thank you. Thank you, everybody.
Thank you.
Thank you, Lisa.